start off the day's proceedings, first let me introduce and welcome you to our first interviewer for the first segment. Described by other Rotaractors as meticulous, reliable, and as the definition of a true gentleman, this Rotaractor does not fail to deliver. Ladies and gentlemen, join me in warmly welcoming Rotaractor Panidu Girihena on stage. And now, to introduce you to our first set of the first two lecturers. Today, we have a living legend with too many titles for me to simply list out. So let's take a quick moment to watch this short montage video. Outgoing and charismatic. I think it's safe to say that this lecturer never ceases to make one smile. So let's take a quick moment to watch this short montage video. The stage has been set and the lecturers have arrived. Over to you, Dr. Hari. Take it away.
Thank you, Jyothi. Good evening and welcome today to the Insights to Inspire. Today we have two very eminent personalities and I hope all of us can learn something from their experiences, especially learn a new and different perspective. Let's start off with a simple question. Prof. Vajira, could you tell us about how you became interested in your fields of genetics and bioinformatics?
So I go back to my school days, I think. First really, I wanted to be a doctor, but I was very, very good in mathematics, but not in science. So in 1984, when I was doing my O-levels, my father came to me 21 minutes, and there's this man who came to visit me today. He does something called a computer to sell. Would you like to have one? I said, all right. And then so we went and saw the computer at his computer shop. So he said, I'll give you a computer, but you have to be first in class next term. I had never been first in class before that. I've been second, third, fourth, or whatever. I've never been first in class. So next time I was first in class. Then I asked for my computer, but he said, I didn't tell you how many times you have to be first in class. So I became first in class next term, but then I marked also. And then I got my computer. So that's how I got into IT in 1984 with that Sinclair Spectrum computer that you saw, which I still have. It's not in working condition. I don't think I haven't plugged it and seen, but that was my first computer. Then on to the science, in the A levels, we had the subject of embryology those days, but I don't think you all had embryology. Embryology is a fascinating subject, and that got me really interested in human development and so on. And when I came to medical faculty, Prof. Dissanayake is teaching and genetics made an inspiration. And so at the end of the second term, I went up to him and said, sir, I want to become a geneticist. And he said, are you sure? I said, yes, I am. And then he said, we'll see. So I kept on meeting him year after year, and eventually he was convinced that he would take me. And that's how I got into genetics. So then eventually, genetics nowadays has become a very much more computer-intense computational science with whole genome sequencing, data analysis, and so on. So looking back, the two interests actually nicely merged. And that's been I think the story is that you have to follow your passion. And one day it may kind of make sense. And that day may come 20 years after and you won't know. So therefore you should not be afraid to follow your passion.
Thank you, sir, for that very inspiring answer. I think a lot of us can learn from how being persistent can actually lead to better outcomes in your case, sir. And the fact that even getting a simple computer probably changed the course of your life at that point. Because I recall, sir, you mentioning that you wanted to do engineering. So could you tell us a bit about how you imagined what sort of engineer you wanted to be?
No, maybe you misunderstood me. When we had that discussion, I kind of never wanted to be an engineer as such. It was always this direction towards medicine. Between the two, it had always been medicine. But there was a kind of a life-changing moment in 1996. And I actually had passed out from the faculty, and I was waiting to, start internship and so on. I was approached by the professor of medical informatics at University of Singapore. He had heard about my interest through Professor Shamfaran actually. And he approached me and said, I have a job, would you like to come? Then I said, I'd applied for genetics in my own faculty. And if I don't get that job, I will come. So I got this job. I'm here still, and I have no regrets about that. The things that I've been able to do here and so on, I have absolutely no regrets. I would have been, I don't know what I would have been if I was had gone to Singapore at that time. But I'm sure that my heart is in this country, and therefore would not have, whatever I would have achieved there would have not made sense.
And we're very grateful to you, sir, for being in our faculty and for everything you do for us, sir. Let's move on to another question. This time to you, Probhodana, sir. Sir, could you tell us about how your journey into the medical faculty was like?
So, now I was very bad in maths compared to sir. So I'm very, very bad, right? So then I had, but nevertheless, since my childhood, I always wanted to be a doctor. In fact, when we came to select, even the subjects that somebody told me in the school that if you do agriculture, then you will be better at, you can do very well in your botany, which we had in our time. So I chose, agriculture. Then I should have chosen motor mechanics. So I had no idea how the cars works and anything, right? So I just know how to drive them. And so I went to so all my passion was always want to be a doctor. And then when I got through my A-levels, then I work in a private hospital as actually a computer operator. And then we did a lot of things there. And it's actually Professor Suresh Dissanayake, one of the faculty members here who has retired some time back. So he was our family physician as well. So he asked me to come and work there until I start medical faculty, which was 2 years after A-levels because of the situation that time. And then I worked with Dr. Rohan Pereira, one of the gynecologists at that time, who was actually my sister's best friend's father. So again, I got to work very close with him, and he used to take me. He comes and you have been selected to medical faculty, come to the theatre and all that, and that inspired me to be a gynecologist. And actually, when I came to the faculty, I always wanted to be a doctor, and I always wanted to be a gynecologist, and I'm living my dream.
Thank you, sir. And I think it's interesting that the fact that you choosing to go and volunteer during those first 2 years after A-levels actually shaped the ambition that you wanted to follow in your future. And I think a lot of us can actually relate as well, because we might have different experiences we witness, especially with the pandemic. And maybe those interests can lead us to a different career than what we actually aspire as of now. Who knows? Okay, let's move on to a very enthralling discussion, I would say. And this question is to you. Dr. Probhodana. Could you tell us about how you actually achieved everything you did at faculty while managing to do a lot of other stuff?
Right. Well, now one thing I want you guys to kind of do is that when you're in the faculty, you enjoy that faculty life, the university life, because it's very different to the life that you have probably had in school. And now I'm pretty sure that we were the last batch to do all the functions in the faculty. We had the freshers welcome, which I was the chief organizer at that time, and then we had the sport carnival, and then we had those days we had something called block night, and we were not in Viva IBS group, but we kept the tradition going. So we had the block sports carnival, we had the block night, and the block concert, which is you can't listen to those dramas now, as they be very filthy and all that, but we thoroughly enjoy those days. And then we had the what you call the going down, and we did all the carols, Ninna, and then we also introduced something called angulation before the going down, right, at the Blom. And so we did a lot of social stuff, and which made us a very, as a batch we were very together, and we did a lot of things together. And we were like, I'm Catholic, I used to go for Vesak stuff, and the Buddhist society stuff, and same vice versa, and we had a lovely time during that time. And one thing I want to kind of, if you all ask me about the take-home message, now one thing I didn't do ever was to cut my clinicals. If I can, like throughout my career, even from the smallest appointment, like 2-week appointment, you will find me, going to the ward at night and seeing patients at night, and also you will see me in the dermatology appointment looking at nail clippings through a microscope, and there. So I have seen dermatophytes and STI. So I can tell you a lot of stories which I kind of can relate to, during my faculty life and about the clinicals. So without a valid reason, I never cut unless I'm sick or something. I never cut clinicals, and it has helped me throughout my career, not in like in my final years definitely. And to my performance, it helped me a lot. And in my final year, I used to go to the ward at 7:30 because the breakfast was served at 7 o'clock, right? And then we were there at 7:30, and then some appointments like pediatrics, we go at 5 o'clock and take our histories, come back, and then go back to the ward at 7:30, and I usually left the ward by 12 midnight or later, right? And it was for a whole 1 year. And during the other appointments also I used to come, and the networking I had, right? During like when I, as a third year's medical student, when I go to the ward at night, the house officer and the registrar, they find me as a atypical medical student and they try to teach me some things. And then when I became house officer in professor unit after my to my internship, and some of the house officers has become registrars now, and some of the registrars has become senior lecturers, senior registrars, and actually two senior lecturers was actually our faculty staff as senior lecturers. So that networking that I knew, I knew the nurses, I knew the staff, I knew the attendants, I knew the radiographer. So it was very easy for me to kind of work there. When I go, I get the ultrasound scan date, I get the CT scan date, right? So with all that was important, and that networking is still helps me throughout my career. And I used to know far like ahead of my seniors, like not only people who have gone out from the faculty, also I knew because of this, and that helped me a lot to shape up my future and all that.
I think I feel a bit intimidated, sir, after hearing your answer. But I do find it very inspiring to hear that a person can actually do all of these other extracurriculars and still work to that extent in clinicals. Especially to those of us who started clinicals, especially those who just started, we know how tiring it is. And the fact that we are barely managing to handle it with pressures and a lot of other stuff going on. So a lot of us might think it's not possible, but clearly Dr. Probhodana is a clear example that you can do a lot more in both faculty as well as in clinicals. On that note, sir, would you like to tell us about maybe an experience or story at the board where you remember as being memorable? Maybe it could be a consultant shouting at you, or maybe it could be like an enjoyable moment with the clinical group.
So I actually can tell you a sad story in my pediatrics, which in my appointment I had a child who was the fifth case with a genetic disorder which was leading to primary pulmonary hypertension. And her name, I shouldn't be telling the name, no, right? So she had a oxygen mask, and she had a little line, and she was on oxygen 24/7. And whenever the oxygen cylinders goes, and that time they take to change it, she goes into a spasm and she becomes blue. And at that time, her father was there because the mother was pregnant, and she was in Mata at that time. And then, so I told you I was in the ward and I used to study in the ward. So there was this, next to the pediatric ward, there's an area where students used to stay. So she comes with the oxygen cylinder and sit with me and play with me and all that, right? And then there was a time that, because there were a lot of issues for the father, because the father was staying with mothers. He was there in the ward and he has to go out and all that. So there was a time I used to go because she became very close to me, and then I had to feed her. She wait till I come to eat. So I go, those are the time at 5 a.m. thing. So I has to go to at 6 a.m. where the visiting time and all that, and go and sit with her. So she eats, and then I used to take a yogurt and all that to her, and then I come back, and then we have to take our histories. We can't say that I was with her, right? In our time, I'll be repeated for 1 week, right? And I did that, and then the final day of my appointment, she died, and that was my, the most. I was actually crying at that time, and I was inside, and Professor Manoli came and talked to me and said these things happened, And so it was something that I was really upset, and I thought, as doctors we can help and all, because she needed this gadget which we could not fund at that time. It was a bit expensive, but people were like, the government was buying cars for more than that, so that was sad story. And but all this inspired me to become a doctor and also to become passionate towards patients and to be with them all the time.
Thank you, sir, for that very personal experience. I think a lot of us also might face an experience like that. And I think it's important that we use that to fuel our determination more than be held back by it. Similar to that, sir, would you happen to have any clinical story about your clinical experience you would like to share? It can be an enjoyable one too.
Well, I think we can summarize what Probhodana said in simple terms: taking clinical leadership. That's what it's all about, and that's what all the students should be doing in your setup. Even as a student, take leadership, get involved. Ward is not a place where you go like a lecture to a lecture. It is a place where you really go and get involved and do things. And I can relate a sad story, but that story is sad because it's sad, but it also emphasized to me that the decision that I made to get into genetics was a correct decision. So I was a house officer in the in Ward 56 of National Hospital, and what was fascinating about that internship appointment was that we did that internship appointment without any senior registrars or registrars, because there was a transition. And my consultant was Prof. Ranaweera's wife, Dr. late Ranaweera. So I was the house officer on call, all by myself at in the National Hospital casualty ward. And here comes a boy being wheeled into the room, into the ward with his two brothers. He was in the wheelchair. He had two brothers, and the two brothers were actually lifting him up and putting him down so that you could breathe. You could just take one look at him and make a spot diagnosis. This was a child with Duchenne muscular dystrophy, going into respiratory distress. And all that had to happen was these two brothers to stop doing that. He would have, passed away then and there. But this episode went on all night, from about 11 in the night till 5 a.m. in the morning. And basically, nobody could take the heart to tell the brothers to stop this. And as the house officer, as you know, the consultants will not generally come unless it's the urgent thing, emergency thing. With no senior house officer or registrar or senior registrar. Finally, after 6 hours of this struggle, in the morning at 5 o'clock, I had to really tell the parents and everybody, this is what it is, and we have to let go. And we did that, and the teenager passed away in a few minutes. But it also emphasized to me that we need to get into these areas. Genetics was not a fashionable field at all at that time. But having got in and having got involved, developing services and so on, I always relate back to that story that getting into genetics was correct, because you are able to help people like that. Today we have therapies for Duchenne muscular dystrophy. but we've also saved people with things like bone marrow transplantation. So like Probhodana's story, bone marrow transplantation in this country took off because we intervened and saved a boy called Sanjana. And Sanjana is now 12 years, and Sanjana's episode was what triggered us to start bone marrow transplantation in this country. And Sanjana was the first one saved in that family. After 15 boys had died in 3 generations because of severe combined immunodeficiency. And the happy story is Probhodana delivered Sanjana's brother last week, who was not affected. So that's the, that's the brilliance of the field that we are in. I mean, as doctors, and, we can do things that other people cannot do. But that can be done, if you get involved. The coughs and colds, they will, go away without us getting involved. But you need to really dirty your hand with the difficult situations, and that's what it's all about when you get involved in clinical. And that's why we keep on impressing on the students, saying, go to the wards, throw the books away, learn from the patients, get involved, do the things. And if this faculty has one lesson to teach, in 1988 and 89, the final year got delayed. And as a result of that, the final year students actually had to go and work as house officers in wards. Do you know how many first classes that batch had when they eventually did their finals? 19.
19 distinctions.
Yeah. Yeah, they're not like today, but that was a different time and a different way of looking at things. And there were 19 first classes, never before, never after in the final MBBS exam has such a number. Yeah, they were good because they got involved, did the clinicals. If not, if they went home and studied books and came for 2 years, they would have crashed their clinicals. So get involved. I think that's the message.
Thank you, sir, for pointing out this message with stories from your end, because a lot of us, even though we really want to, it can get bogged down a bit. But hearing stories like that actually inspire us to keep trying and keep learning and keep growing as well. So thank you very much to you, both of you, sir. So let's move on to a different question. Vajira sir, could you tell us about how you got involved in administration and what that experience is like? Because it's a lot of us are very interested to hear about it.
Okay. Administration is all about discipline, right? So how did I get involved in administration? By sweeping the floor in my class as a student. I did that every day. And I was very happy to see that I have transmitted that autosomal dominant to my son. And so every Thursday morning, including today, I have to drive him to school at 6:30 because he can sweep the floor. So he wants to do that. So administration is something all about discipline. Right. And so, if you so I always say, from grade 1 to A levels, I was the monitor in class. I came to faculty, and from first year to last year, I was bachelor. Everybody wanted me to be. So then, after that, so that kind of gave you a little bit of training. And then soon after I passed out, I became a council member in the Sri Lanka Medical Association. And then we found a year or two later that as an intern house officer, I cannot be a council member of the Sri Lanka Medical Association. It was unconstitutional. But anyway, so I was. And then 2000, I was kind of, suddenly all the, very old eminent doctors said, year 2000, Vajira Dissanayake should be the secretary. And that was like, this small fellow being given the hot job. Because SLMA at that time was, the organization within the colleges and associations all over the place like this, and for all the doctors to come and say, you are the guy who should be the secretary. The millennium year was, really a hot seat. And then I had the late Dr. Kumari Sekar as my president. He was a very busy clinician. He was an oncologist and very busy clinician. So he basically delegated all the administration to me, and so I had to do all of that, and that was a bit like, really got me going. And then, of course, as time went by, I came back to the faculty and got involved in a lot of things, and also when I was in the faculty, I was in the union and did all of that. But then I think it's a kind of a natural thing each time. People would appoint me to be head of department or head of unit or head of this or head of that. So it is something that came naturally. But what has, so I believe that along the way I have been able to do my job in all of these places successfully. So the reason probably I was successful is discipline. I think that's the most important thing. And but if you are to be successful in administration, I think you must understand that that is a privilege that you have, and you are there to help people. So everyone who walks through my door, whichever the position I am in, and ask me something, I try to help that person. It's very rarely that I would say no. And if something cannot be done the way that person wants, I will also show the way it can be done through another mechanism. And that's so very important. So as an administrator, you have to be an enabler, not somebody who puts everybody who walks through your door. And it's not as if you are there to exert your authority. You have to exert your authority to a certain extent as well. So the students know here. I say yes to a lot of things, and I say no to certain things as well. And it's you have to assert yourself, and you may also have to show things that you don't see. I think when we had that discussion, you were also asking about the international experience. So that also came naturally, So it so happened, you asked me that day about the Commonwealth Medical Association. So the first president of the Commonwealth Medical Association was a Sri Lankan physician, Dr. Probhodana. And his son is a very prominent general practitioner. Some of you may know him, Preeti just general, and you all may have even done appointments with him, or will do appointments with him. And so the Commonwealth Medical Association has asked who they would like to come to Sri Lanka, who should be the president, and Preeti had said, there's a guy called Vajira Dissanayake. So you ask him. And so the former president of the Commonwealth Medical Association, Prof. From India, he actually came down to Sri Lanka to talk with me and see whether I was suitable. And then I got the job, as it were, and that's how things move. But one thing is that as a Sri Lankan, you can be very proud when you are in all those associations, because our health system is recognized everywhere in the world as the most efficient health system with the least investment. I have been in 2004. I was in as a PhD student making a presentation in Montreal in Canada. I was at a conference, and I was in this room. The only brown person in that room, about 75 others. When a Canadian got up and started talking about the fascinating health system in Sri Lanka, I was kind of in tears. Here is an entire conference. I was the only in Sri Lanka. There were about 700 people. Session, somebody gets up and talks about Sri Lanka. And that's the value in which Sri Lanka's health system is held. So don't put off by any of the stories that you read in newspapers in Sri Lanka or social media in Sri Lanka or the TV in Sri Lanka. Our health system is the best health system in the if you want to call it developing world, and we can stand up and stand in front of any audience anywhere in the world because of that, and be proud of what we are and who we are. So that is a message that I want to take, and that has helped me to stand up in these organizations, in these fora, and talk to people and impress upon them what has to be done. And so when people like Probhodana go to obstetrics and gynecology sessions, everybody talks about the fantastic maternal and child health services in Sri Lanka. And Probhodana, you can add to this. I think when the Royal College celebrated about 10 years ago, one of their big celebrations, there was one big section entirely on Sri Lanka's maternal and child. Did you go for that?
No, sir, that's fine, man.
Yes, I was a little bit.
Yeah.
But that's the so we are all part of that huge legacy. And so when we go abroad or anywhere, we don't have to be ashamed or afraid or whatever. We can stand up. We have done proud as a profession, and that is so very important.
Yeah, I just want to comment a little bit more. And now, all this has happened because our precedents has done their job properly, and it's for you guys to carry that torch, including us. And from Junior, now I see that one of the main reasons for us to come back to Sri Lanka, like when we were there, all of us, I'm sure, Prof, and everybody, we get offered job there, the way that we work and all that. And we come here because there's something in this country and which we have put our hearts to it. And sadly, sometimes I feel, when you are working, and sometimes you all don't see that, it's happening. And now, if you guys, and I always say that to students, that you have to be the champion for the patients. And so you have the power, and we have sometimes, a power that we are not familiar with. Right? And we have to use it in a certain way, and we have to help people rather than, like telling, you go off and all. Because, you're helping a countryman. Because I see that when when you go to England or wherever, for everything we have to get consent, we have to be, working in a certain way, and we have to talk in a certain way, because otherwise you will get a complaint and all that. But then when you come back to Sri Lanka, and when you come and you talk to your country persons, like, we are people, and then you treat them like dirt, and should not be happening. And it's you guys who has to be this behavior sciences and all that. You are taught about that, and you have to live that. Right? Not just learn it and get a distinction or a gold medal out of it, but then forget about it. And you have to make sure that you continue that legacy. That as Sri Lankans, we are very proud. As Prof said, wherever, wherever I go. Right, so I like our, the maternal mortality and our skills are, they appreciate it. And, when a Sri Lankan comes for a job, all of you will definitely get jobs abroad. Because that is because the way that people have been working. So to continue that, you have to work, you have to do your thing, you have to be honest with your job. That's what I usually say.
Yeah, just add to add a couple of things to what Probhodana said. Couple of things came to my mind. The first one was in 2007, I got a fellowship to work at the National Institutes of Health in Maryland, in USA. It is the biggest clinical research hospital in the world. There are 1,500 beds. Everybody who comes in there is on a clinical trial, the best care you get in the world, and so on. So best, hospital to be in. I got an opportunity to give a talk there during my fellowship, and I was thinking of how I should start my talk. I wanted to make the point that Sri Lanka it's not a pushover. So my first slide was the hospital in Mihintale in 400 BC, the ruins of the hospital. And I put that slide and I told the people who were in the audience that I am aware of the fact that I am giving this talk in the best hospital in the world today. But all those years ago, 400 BC, the best hospital in the world was in Sri Lanka, and these are the ruins of that hospital. And I took the pictures of the surgical scissors that have been taken from there, which resemble the current day surgical instruments. And I made it a point to tell them, we don't know what technology they were using, but they were also talking about all kinds of transplant. And if they didn't do that, people would have laughed when they are mentioned in the scriptures and others. So probably all these transplants were happening in this hospital. And this is the archaeological evidence for it. So people in the audience were fascinated. So we always think of, what we are using, the instruments and other stuff. This could all be a rediscovery which is happening in cycles. So we can stand up and, stand up for what we are and talk to people. The second point I wanted to make was in the year 2012, when I was the president of the Sri Lanka Medical Association, I got the opportunity. So I wanted to make it a big event, a big year that year, because it was 125th anniversary. So I wanted to have conferences, big conference in Colombo, but satellite conference in other places. So as I said, I was the youngest person, a very young person in the SLMA. 2012, when I became president, also I was the youngest ever president of the SLMA. I was 43 at that time, so never been nobody so young. So I was, whenever I go to any event in Colombo, I'm a small fellow. But when I started traveling around the country, everybody, all the doctors were younger than me, so I was the oldest person in these audiences. Then I came back and I asked the Sri Lanka Medical Council for their register, and I did a statistical analysis, the age analysis of doctors in Sri Lanka. So when I looked at the doctors who had passed out of medical schools in 1960s and 70s, there was hardly anybody in the register. Very few people. The doctors in the register were those who had passed out mainly in the 1990s and after the 1990s also. Then I started talking with some of the senior professors and so on. What happened to these doctors? They said, all these people left the country. all the people who passed left the country. Soon after the finals, there was a ECFMG primary, and the next flight to London, it was all doctors. Right? But what fascinates me is those people who were left behind in this country built a health system in this country which is second to none in the world. So it is a case of survival of the fittest. The fittest remained in this country and built a very, very strong health system which brought down maternal mortality, infant mortality, eradicated all of these, immunizable disorders, and our life expectancy and everything is comparable with the West. Our health demographics are not of a developing country, they are of a Western country. And so the people who remained here built this fantastic system which has now grown into all the subspecialties and so on. And you are the beneficiaries of that. Beneficiaries of what was created by these people who remained in this country and built this. So Suddhas are not going to come back and develop health system for us. It is we who are going to build this health system and make it more resilient for the future. The outcomes of what the challenges that we are facing, the final point I would like to make is that we need to innovate in the face of these challenges. And those innovations should be what we call frugal innovations. What do you mean by frugal innovations? Frugal innovations are low cost but highly effective, scalable innovations that can make a difference in the lives of people. So we really need to now go to a next phase. In the face of the challenges of the the demographics that we have today. What are they? Aging population, a population that has non-communicable disorders as the main afflictions that they are affected with. Bring about our own innovations without being dependent on imported technology. And if we do that effectively, we don't pay these dollars. We will be able to build a resilient health system. We have the manpower. We will also have our own technology. And that is what we need to achieve. We need to try to achieve. And as young people who are coming into the forefront, that is what our medical students should be equipped with. And I'm actually at the moment doing some background work to see how we can bring innovation into the curriculum so that you can be clinicians, clinical leaders, but also innovators who can bring in frugal innovation that we can act as substitutes for everything that we are importing now and take our health system to a different level. I think that is what we all need to try to do.
Thank you, sir, for both of you, because that was a really in-depth discussion on the Sri Lankan healthcare system. And I hope that all of us can actually aspire to reach your levels and maybe even push it to an even greater height in the future. Again, I would like to thank everyone for listening in for this very interesting and entirely discussion. And I hope all of you got a new perspective compared to what you had before. And maybe you can use those insights to inspire you to a new height forward. So thank you very much to both of you, sir. And I would like everyone to please do a huge round of applause to Professor Vajira, Dissanayake and Dr. Thank you very much.